Hi, my name is Chelsea Deitch and I'm a student nurse at Cedar Crest College. For my evidence-based practice project, I decided to do my topic on the health benefits of breastfeeding as compared to formula feeding. I decided to do my topic on this because after having my clinicals this past year, I enjoyed my mom-baby clinical the best and I could see myself pursuing a career in this field in my future. So my PICO question is, in infants, how does breastfeeding as compared to formula feeding improve health? So the significance of breastfeeding is that it can help reduce infants' exposure to contaminated foods and liquids that their potentially underdeveloped immune systems might not be able to handle. Another thing is that breast milk is significantly important to infants because it contains natural immunological agents such as IgG and IgA, which have anti-inflammatory effects that work by fighting off the bacteria and toxins that may be harmful. And then also, according to the National Immunization Survey, the initiation of breastfeeding rate among infants in the United States is a total of 75%, but overall, only 13% of those breastfed infants are breastfed exclusively for the first 6 months of their life. So for my literature search, I used the databases Google Scholar and PubMed. The main search engine was Google Scholar, and I used the keywords breastfeeding, formula feeding, benefits, and infants. And then that yielded about 156,000 articles. I then specified the date range to be that articles had to be published between 2009 and 2017. So then that yielded about 17,000 articles. I then went through the first 40 pages of Google Scholar and I picked out articles that best matched my PICO question, the titles of the articles that best matched my PICO question, and that yielded about 23 articles. I then went through each of the 23 articles and I read their abstracts, and in order to be included in my study, the abstracts had to have my 4 keywords included: breastfeeding, formula feeding, benefits, and infants. And then that yielded my articles to about 8. And then I used the hierarchy of evidence to narrow it down to a total of 3 articles. So for my first study by Lamberti et al. Was published in 2011. The title of this article is that breastfeeding and the risk for diarrhea, morbidity, and mortality. This is a meta-analysis of 18 studies, and the purpose of this study was to examine the protective effects that breastfeeding exposure against diarrhea. The results of this article was that it showed that not breastfeeding resulted in an excessive risk of diarrhea among infants 0 to 5 months and 6 to 23 months compared to breastfeeding. So, and then for my second study, by Salone et al., it was published in 2013. It's titled Breastfeeding: An Overview of Oral and General Health Benefits. This was a meta-analysis and a systematic review of 16 studies. The purpose of this study was to determine the general health benefits of breastfed infants compared to formula-fed infants. After reading this study, the results were that the health advantages associated with breastfeeding lower the risk of acute otitis media, gastroenteritis, severe lower respiratory infections, asthma, obesity, leukemia, and diabetes type 2. For my third study by Gale et al., published in 2012, titled The Effect of Breastfeeding Compared with Formula Feeding on Infant Body Composition, a systematic review and meta-analysis, used 15 studies, and the purpose of this study was to determine body composition in infants in relation to breastfeeding and formula feeding. The results of this study were that formula-fed infants showed a higher change in body composition than breastfed infants. So the fat-free mass was higher in formula-fed infants than it was in breastfed infants. For the recommendations for practice, there are 3 of them, and the first one is that mothers should breastfeed their child exclusively for the first 6 months of their life as a key survival intervention. The second one is that mothers should also continue to breastfeed for at least 12 months of age, any form of breastfeeding. It doesn't have to be exclusive. And they should breastfeed their child for at least 12 months or longer, depending on how the mother and the infant would like to. And then incorporate other foods and liquids, but let the main source be the breast milk. And then the third recommendation is that continued research needs to be done to update the different size estimates of the results, and just to keep the results updated with the year. So in conclusion, breastfeeding has improved health benefits compared to formula feeding. The breast milk improves infants' immune systems, which helps them fight against diseases, and it's helpful with growth and development and cognitive development. Thank you for listening, and I look forward to hearing your responses and answering your questions.